Princess of Wales cancer diagnosis shocked the world, but has also raised some red flags regarding a troubling cancer trend. According to a worldwide study on cancer, cases among people aged 14 to 49 rose by nearly 80% between 1990 to 2019. The researchers behind the study also estimate that cancer rates for those under the age of 50 will rise another 30% by the end of the decade, with wealthy countries being particularly affected. Joining us now to discuss the alarming trend is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us today.
Good to be here.
This is an alarming trend, but do we have any idea why cancer rates for younger people are on the rise?
Absolutely agree. A very alarming trend indeed. We have some idea. We do believe that obesity or excess weight is likely a significant contributor to this. We know that adipose tissue produces hormones that can promote cancer growth. Obesity is also linked to insulin resistance and chronic inflammation and altered immune function, all of these things playing a role in cancer development. We also know that early screening, which we are doing more often now, is playing a role in there, and also likely changes in genetic factors and the gut microbiome, which is playing a role again in the inflammation and immune responses.
So you're talking about the link between obesity and cancer. Is there any other link besides obesity that you think of?
I think what we're seeing as well, aside from obesity, is certainly some lifestyle changes as well. There's more sedentary behavior. There's certainly more processed foods and environmental toxins in our environment, and that certainly is also playing a risk here.
Is there a rise in cancer for those under 50, something that you are also noticing in your practice?
Yes, I think what we're seeing in medical practice for mine and many of others as well is a fair increase in cancer diagnosis, especially much younger than we would like. What we're seeing here is usually people with these diagnoses do have some environmental exposure, so that could be carcinogens in the environment, pollutants, radiation certainly can impact those cancer rates. We're seeing changing reproductive patterns as well. So those hormonal factors also play a role in cancers such as breast and ovarian cancer. And also we are employing earlier screening practices based on guidelines as well. So we're catching these cancers a bit early as well, which normally we may not have caught until later on.
Now, you mentioned breast and ovarian, but are there specific cancers besides those that are becoming more common than others in those under the age of 50?
Yes, what we found specifically as well as colorectal cancer. So this used to be quite rare in young adults before, but now it's becoming quite a growing concern. We see a lot of this, and we're concerned it may be more related to dietary changes, so a higher red meat consumption, for instance, lower fiber intake, and more sedentary habits. Breast cancer, of course, we're seeing those changes as well, and people are getting diagnosed much earlier. We're also seeing thyroid cancer here, and we're doing increased detection with imaging studies for this, and melanoma. So sun exposure and tanning practices are likely playing a role with the increase in melanoma in younger adults.
And why is this something that is particularly impacting wealthy countries? This might seem counterintuitive to some, as wealthy countries have better access to medical care and have lower rates of poverty and other illnesses.
Yeah, it is definitely paradoxical. Part of this might very well be a sedentary lifestyle when we're looking at wealthier countries. Greater access to processed food, so that convenience trumping nutrition. Increased stress, high pressure jobs and lifestyles definitely impact health. And of course, urban environments do expose us to a few more pollutants as well.
What can be done then to best combat rising cancer rates, or at least, the very least, detect these cancers early to increase the chances of surviving?
Right. I think a big part of this is just education awareness, raising public awareness about these risk factors and symptoms and the importance of doing regular screenings, following screening guidelines, guidelines for breast cancer, colorectal cancer, and skin cancer. And of course, a healthy lifestyle, really emphasizing on whole foods, fruits, and vegetables, and increased physical activity.
Now, just finish up here. When should someone evaluate whether or not they should seek medical attention for screening?
I think it's important to be very proactive with family history. Many of us don't know our family history very well. So keeping in mind, what happened to your cousins, your uncles, your aunts, and your immediate family as well, because you could be at risk for that. And then having a discussion with your doctor about age-appropriate screenings. And some of these screenings we do earlier if you have that family history. So make sure you communicate that with your doctor as well.
Thank you very much for your time.
Thanks for having me.